Hello and welcome. My topic for this presentation is eye movement desensitization and reprocessing therapy treatment for post-traumatic stress disorder patients by Jennifer Reddick, University of Texas, Rio Grande Valley. A little bit of the background of the problem. Depression affects a minimum of 350 million people worldwide, and almost 1 million commit suicide annually. Eye movement desensitization and reprocessing, for short, we'll call it EMDR therapy, is a scientifically recognized post-psychotherapeutic therapy for post-traumatic stress disorder, which is in short PTSD. PTSD is known as shell shock, a vague condition affecting war veterans. PTSD is now recognized as an anxiety disorder brought on by a traumatic event. Currently, PTSD affects an estimated 2.2% of the population. That calculates into 7.7 million people, men and women. 11 to 20% of veterans of the Iraq War and the Afghanistan wars, which comprise about 300,000 people. Other statistics: women, 10% will develop PTSD in their lifetime, and men, 5%. Men and women, 7 to 8% of the population will experience PTSD at some point in their lifetime. Men and women, 55 to 75% of the population will experience a traumatic life event in their lifetime. While there are effective treatments available, many people, especially veterans, do not seek or receive help for their condition. So my proposed practice change would be EMDR therapy treatment to reduce the symptoms or the manifestations of post-traumatic stress disorder in patients. There would be 1-hour weekly sessions of EMDR therapy where you would sit down with the patient. According to Chin, there are no consensus on the number of sessions recommended to treat PTSD in this review. So what is EMDR therapy? Desensitizes clients to anxiety, and it integrates information processing developed by Francine Shapiro. Adaptive information processing is a theoretical framework. It conveys elements connected to pathology and personality development. It supports oriented responses that retrieve information from prior experiences and incorporates them into positive emotional and cognitive schema. Dual attention stimulus, like eye movement, is an essential component. Promotes positive physiological conditions that activate information processing. Eye movement have potential to unblock the information processing centers of the brain, creating a connection between stored information on prior events and adverse outcomes that is used to generate a response to a current stimulus. EMDR therapy is an 8-phase treatment approach comprised of standardized protocols and procedures. And this was created by Shapiro. The 8 stages would include history taking, preparation, assessment, desensitization, installation, body scan, closure, reassessment. The evidence. EMDR therapy is a treatment model that can alleviate the manifestations of PTSD. The evidence points that traditional exposure-based therapy models have different processes. Research is considering the function and structure of the memory system in connection with the role in PTSD and EMDR therapy. PTSD is a complicated disorder. Underlying mechanisms remain to be investigated and understood. EMDR has been confirmed as an effective treatment for PTSD and meets evidence-based practice in Criterion in the UK. Recommendations: EMDR therapy could prove a favorable psychotherapeutic path for the treatment of PTSD and comorbid manifestations in adolescents. It could also prove favorable in reducing PTSD manifestations in patients with substance abuse disorders and non-trauma focused PSD treatment. Future studies, RCTs, random control trials, are needed to evaluate the efficacy of EMDR in patients suffering from PTSD. The implications for practice: psychiatric mental health NPs may be able to incorporate EMDR therapy for the following attachment disorders. According to McGuire: grief, nightmares, other anxiety disorders, substance disorders, or comorbid disorders. In conclusion, EMDR treatment for PTSD patients is recommended as a treatment by several organizations for PTSD, including the American Psychiatric Association, the Department of Defense, and the World Health Organization, or WHO. EMDR therapy can decrease subjective distress and aid adaptive cognitions associated with the traumatic event. EMDR therapy can help clinicians to readily determine the degree to which distressing experiences are a contributing factor and to adequately address the dilemma through memory processing that can help facilitate both psychological and physical resolution. However, more rigorous research is warranted to help decipher for possible remediation and preventative care. That concludes my PowerPoint. Thank you all for listening and reading along. And here are the reference pages. References. The end.